Mid-career OBGYN renegotiation, tenure, surgical volume, call reduction, and the partnership track conversation. The 2025 National OBGYN compensation data shows a $156,163 gap between the 25th and 75th percentile of total compensation for general OBGYN physicians. $332,598 at the lower quartile, $488,761 at the upper quartile. For physicians who have been in practice 5 or more years and have not revisited their compensation structure, the question is whether the current position on that range reflects the value they now deliver, or the value that was established when they were first hired. Mid-career renegotiation in OBGYN is distinct from initial hire negotiation in 3 specific ways. First, surgical volume. An OBGYN physician 5 years into community practice has a defined surgical case volume, procedure mix, and complication profile. That track record is a data asset. If your surgical volume, cesarean sections, hysterectomies, laparoscopies, complex gynecologic procedures, places you in the upper half of your group, that productivity is the foundation of a compensation revision argument. The dollar per work RVU rate in your original contract was set against an expected volume. If your actual production exceeds that expectation consistently, the rate deserves revision. Second, call tenure. OBGYN call burden is not evenly distributed over a career. Junior physicians in group practices typically carry heavier call ratios, while senior physicians carry lighter loads as a benefit of tenure. If your call ratio has not decreased proportionally with your years of service, that is a negotiable item. The 2025 national data shows unpaid on-call hours at 42 hours per week median, a burden that compounds with career duration. A senior physician who is still carrying new hire call ratios is subsidizing a group structure that has not recognized their tenure. Call reduction is a compensation revision even when the dollar figure in the contract does not change. Third, partnership track. For physician-owned and private practice groups, the mid-career conversation includes the equity question. A physician 4 to 6 years into a group practice should have a clear, written timeline for partnership consideration, or a clear understanding that no partnership track exists. Partnership typically brings profit sharing, governance rights, and equity value at eventual sale. A physician who is not on a formal track is effectively funding the practice's profitability without a path to sharing in it. If no written partnership timeline has been provided, requesting one is not a threat. It is an appropriate professional expectation for a physician who has built a panel and surgical volume for the group. The renegotiation conversation is easier when it is framed around data and performance, not tenure alone. Come with your work RVU production for the past 2 to 3 years, your surgical case count, your patient satisfaction scores, and a comparison to national benchmarks. That is the package that supports a revised number. Employers revise compensation when the cost of not doing so, the risk of losing an established physician with a built panel and surgical privileges, exceeds the cost of revision. Making that case clearly is the physician's responsibility. Run your contract through ClauseLine at clauseline.com.